Greetings, everyone. Let's talk about Chapter 6, which focuses on teaching communication skills to our students. The learning objectives for this chapter, as you can see, we're going to go through 4 different parts here. We want to really look at the definition of language and communication, identifying the characteristics associated with autism that have to do with language and communication, describing the different components or importance of language assessment that's really comprehensive, language and communication, and then identifying specific approaches to teaching language and communication skills and doing some comparing and contrasting of each so you really can figure out what would work best for certain students or certain situations. Let's jump on in. So the first section is talking about our learning objective is that you would be able to define language and communication and differentiate between the two because they are 2 different things. So here we have a breakdown of language, which is the arbitrary use of symbols, really. You know, all those letters we use are just sort of arbitrary. They only mean something because we decided as a group that we would give them meaning. With affected reference that can be arranged in different sequences to convey different meanings. It's a code. Pretty cool. Communication, however, is someone sending a message and someone receiving a message. So those can be through multiple means. Frequently, that's through a language system like speech, but we all know that a large part of communication has to do with body language, and tone and that kind of thing. So it's more, communication is more, it's broader than the idea of language itself. However, language skill deficits can really inhibit that sending and receiving of messages. So when you have language skill deficits, it's really difficult to really fully engage in communication with others. There's 2 types of language that we focus on here. We have receptive, which is that receiving, your ability to receive and comprehend or understand a message, a communication, or a language. Deficits in this area can result in a lot of challenges, including things like following instructions or answering questions. Makes sense, right? If you don't understand the words coming at you, then it's hard to understand what you're supposed to do with them, right? So expressive is the opposite. It's that ability to produce a message that other people actually understand. Deficits in this area, it just limits it really limits your independent functioning, or frequently what we see, especially with our children, our individuals with autism, is we see challenging behavior because the challenging behavior becomes their form of expressive communication as opposed to the use of language. The components of language, and these are important for you to understand, especially when you're really working on communication with your students. We have phonemes, which are just the individual speech sounds that you use within a language. So the ah, I, k, d, those kinds of things. Morphemes are the smallest units of meaning in language. So the prefixes, the suffixes, the root words, those are morphemes. Syntax are the grammar rules that we have in a given language. Prosody is the cadence, rhythm, and pitch in speech, which a lot of times we actually have to teach our students with autism because they tend to there can be, for some, a tendency for a robotic prosody, especially in that pitch. So you might have to do a lot of role playing to get that, to improve that area. We have semantics, which is the general meaning of language. And then the big one, pragmatics. And this is another one that's really tricky for a lot of our students. It's that situational context of language. Knowing when to use certain phrases or responses to things. It's the determining who says what to whom and when and how, and that there's a lot behind that our students don't necessarily understand and may have to be directly taught, which is why we rely so much on different types of scripting and scripts and role play with our students, because we're trying to teach them at least a semblance of what do you do in this context. For example, when someone says hello to you. And it depends on who's saying it, right? And where you are and when. So practicing those different skills and those different situations can be a really important part of your communication skill training with your students. Verbal behaviors, as defined by Skinner, fall into these three main areas. We have a mand, which is it's a verbal behavior that's motivated by the desire to obtain or avoid something. So it's making a request of some kind, whether that's to get something or to obviously get out of something, avoid something. A tact is a verbal behavior that involves more of a labeling or identifying something in response to a discriminative stimulus. And that discriminative stimulus does not involve the verbal behavior of another person. So it's not you saying something to them that gets them to have to tact. It's them seeing something like, a picture of something that they like. And it's not that they're requesting it, they're just noting that it's there, right? They're identifying that. That's Thomas the Tank, right? In the book, that's Thomas the Tank. Intraverbal is the verbal behavior that occurs in response to another person's verbal behavior. So here we have that conversation, the back and forth. That's the meat and potatoes, right, of verbal behaviors. Then we have the functional properties of communication. There's requesting, which is a type of mand, and that's maintained by positive reinforcement because it satisfies a need. You make a request, you obtain whatever that request was based on. Protesting is another type of mand, but this one's maintained by negative reinforcement. So you say no, and then you don't get the thing, right? That's the negative. It reinforces the behavior by removing something. So responding to social, initiating and maintaining social interaction is a big one, right? It's a combination of mands, tacts, and intraverbals. It's the way you sustain a conversation by staying on topic, using appropriate turn taking, and gestures and mannerisms, which honestly, guys and gals, folks, sorry, that differs based on region, culture. A lot of those communicative gestures, I can just speak to coming from growing up in the Southwest, living in Las Vegas, and then moving to this area, Southeast Georgia. A general expected communicative response or gesture during a conversation where I grew up would just be kind of nodding and saying, just very small vocal interjections. Whereas I've noticed here with a lot of folks, there'll be a lot of yes ma'ams, where I would have normally just gone, and shaken my head. So keep in mind that is something, when you're teaching students, that's very regional and very culturally based. So when you're teaching specific scripts, kind of keep that in mind. Responding to social initiatives is a type of intraverbal. So it's a range of behaviors such as if someone says, come on, you follow them, or someone invites you to play a game and you agree to join. Those are responses. Something else is coming at you socially and you respond. Seeking comfort is when, we're upset and we run to mommy or daddy when you're hurt, or teacher or whoever, or distressed, and you ask for a hug or whatever it might be. You're seeking comfort. That's a form of communication, obviously. Expressing interest in the environment is a type of tact. You're identifying things you're interested in within the environment. You comment on something that's new or unusual. And those are the basic functional properties of communication. And these can help guide your lesson planning, because it might be that you focus on a certain aspect here, depending on what your student needs to work on. It's a way for you to kind of break it down. Language development kind of follows this path you see based on the age of an individual, or typically. So hollow phrases are 1 or 2 word utterances that can be used in a variety of contexts. These are what we see from children who are around that 12-month age mark. They're using 1 word utterances. It's not too complicated. It's those beginning phases of speech. Telegraphic speech is usually more when we get to age 2 and we're putting 2 or 3 words together to speak, to express ourselves, you know. So like the book talks about come outside, sit mama, give juice. So it's missing, it might be missing some, you know, important parts of speech that would be used later, but at this phase, it gets the most essential out, right? That's telegraphic speech. Joint attention, this one's really important. It's a foundational social and communication ability that involves 2 people who at the same time attend the same stimulus. So like I'm trying to read the student a story and we're both looking at the book. That's joint attention. Without that, it's really difficult to teach because the student's not necessarily with you paying attention to what you're trying to show them. And then next, we're going to talk about language difficulties. Our learning objective for this section is to identify the language and communication characteristics that are associated with autism. There's actually a really great table, table 6.3, that kind of goes over bullet points of different areas of language that typically we find challenges somewhere throughout those different areas for students with autism. Certainly, as we know, since it is a spectrum disorder, that they can fall from, you know, lots of different points within that space. So we'll talk about that in a second. But many individuals with autism experience difficulties in almost all aspects of language, along with deficits in cognition and social interaction skills. And that's typically what theorists believe is the reason for the language delay, has to do with the type of cognitive differences that students with autism may have that affect their ability to pick up language the way others do. We also see that many children with autism also have a comorbid disability in the area of an intellectual disability, which obviously would have effect on their development of language and academics and just learning anything. It's just a longer process for our individuals with intellectual disabilities. They may fail to develop this awareness of cause and effect, which is why many of you focus on that in your teaching with your students. And they may struggle to interpret and use symbols because this is a higher order thinking process. It involves, you need a lot of working memory to get that going. So we see challenges with that. Common receptive language problems you might see are abnormal responses to auditory stimuli. They may be very sensitive to certain tones or pitch or volume, which then, you know, if they find someone else speaking to them to be an aversive process, right, then they're not going to want to listen. They're not, and therefore they have reduced receptive language skill. Poor performance on language comprehension tests. We see a lot of our students, they may develop a lot, you know, these decoding skills. They understand the word, but they don't necessarily understand what all those words mean together. There's a very literal tie to the word itself. They may have trouble understanding sentences because of the same reason. Appear agitated in the presence of certain voice tones and pitches, like I mentioned. They may emphasize syntactic structure versus semantic content. So they're going to get caught up in those literal meanings of your sentences. So here's where you have a lot of problems if you phrase something in the form of a question, or you use kind of a different colloquialism or something that's not really directly what you want from the child or what you want to express to the child. It's more of a kind of roundabout way to say it. Then they may struggle with understanding that. So keep that in mind. You might have to be a little more direct in your language. That doesn't mean you don't use those other phrases, but you may have to specifically teach them on what they mean. Common expressive language problems, word use and articulation might be a problem. Syntax and morphology Well, the word use and articulation really has more to do with sometimes our students will perseverate on certain words. There's some sort of, feedback that pleases them, so it becomes a self-stimulatory behavior. Syntax and morphology, we see some issues with that, but not as in depth. Sometimes there's trouble with verb tenses or articles, especially when reference change between the different speakers. And, when you say it, then you would use a different verb tense or whatever. That part might be challenging. Pronoun reversal is not uncommon. So instead of me speaking with the I might refer to myself in the you instead. And therefore, that can be obviously pretty confusing to the listener if the student says, you want to go to the bathroom, when they really mean I want to go to the bathroom. Echolalia is pretty common, and there are 3 types. We have immediate, which has to do, they utter something that's repeated directly following the occurrence of that word, someone else saying it. And using the same intonation and pitch and so on is pretty common. Delayed echolalia, it's also called palilalia. That's when they duplicate something that occurred at some point, but not immediately beforehand. So there's a delay. And then mitigated echolalia, these will be an echo, but they'll change slightly. So if you say, the example in the text was, a parent may say, stay away from the swimming pool, and then the child repeats, no swimming pool. So they changed the phrase, but the idea is the same, and then they might repeat that. Okay. Prosody refers to, as I mentioned earlier, that intonation, the speech rhythm and inflections that you use. The common problem we see for kids with autism in this area is a tendency for robotic speech, except for when they're echoing, right? So that is something to look out for. And then nonverbal communication can be challenging because they may not, because they're maybe the eye contact or watching others can be an aversive thing to some. They may not be picking up on what those gestures and body cues are saying. So that's something that might have to be specifically taught as well. A big area of challenge for our students is problems with pragmatics. And that's really the being able to follow those conversational rules, waiting your turn to talk. And then when it is your turn, to have something to say that's relevant to what was being spoken about. And then staying on topic instead of, what we see a lot is they'll perseverate on an idea, and you might be trying to talk to them about something else, and they'll bring that other idea in, even though it's nothing to do with what you've been talking about. Being clear and unambiguous is also part of it, and using cohesive sentences. Those are kind of part of the bones of pragmatics that many of our students struggle with. Children with autism generally are less likely than peers to make relevant responses to conversational turn taking. They may struggle with expanding the discussion beyond that first question. So you might ask them something and they say yes, and then you get nothing, right? Crickets. Or adding new information may be challenging, especially on topic. Children with autism can generally seem to be more likely than peers to provide one-word answers or just not respond. They might imitate the responses of the peer, so that echolalia comes into play, have a limited ability to use contextual cues or interpret intent, and this is a big challenge, and then have trouble monitoring listeners' needs because they're not reading that body language when the person's starting to turn away and kind of go, they're not understanding that that person's trying to send the signal like, yep, I'm done with this conversation. And that's hard to teach. It's really hard to teach, but that's when all those social stories come into play. Problems with language form really have to do with the problems they have acquiring and using language in general. So what results is the student resorting to idiosyncratic topographies of communication. So they just start to get a little odd in how they communicate, in the way they communicate. We also need to keep in mind that because our students may struggle deeply with building those skills, they may display a wide range of behavior that is really meant to convey, it's to communicate. This is the way they've figured out how to communicate so far. Speech may also be used in non-communicative ways. Like we mentioned earlier, it might sometimes be a stimulatory behavior. They might be saying a word over and over again, not because they're telling you something, but because they enjoy saying the word and the sound that it makes. Also, too, when we hear that scripting, it may not be, the words they're using may not actually convey what they're actually meaning, but may be tied to what they're trying to say. And the big thing I want to point out here is that we should assume communicative intent in most behavior from our students. So you're always thinking about when you see a student with a challenging behavior, instead of thinking they're misbehaving or they're trying to make me mad, think more about what are they trying to communicate here? What is it I'm missing that my student wants to say? And when you start flipping the perspective that way, it really helps to A, stay calm in the face of challenging behavior, and B, to really start to get to the function of that behavior itself. So the next few slides really are going to break down that table I mentioned, table 6.3, and what's nice about it is it kind of gives you general categories. For example, we have receptive language problems, and then a bullet point list of some of the problems you might see with your students. An inability to attend to auditory stimuli, or to act on it, or to imitate it. There might be some challenges with that when receptive language. An inability to use contextual clues to obtain meaning. So that's where we need that more direct language use with our students, because they may not be able to get it if you're using kind of ambiguous terms. They may appear deaf because they're not responding. They may also be overly sensitive to sounds, so it's difficult to practice that receptive language if they find the sound itself aversive. Obtain meaning from word order and not semantic content, or a failure to understand indirect or complex sentences. Expressive language problems that we see, a mutism, where they just don't speak. They're, whether that's a physical issue or they select that option. Word use and articulation can be a problem. Imprecise articulation and obsessive use of vocabulary, certain vocabulary that they perseverate on, or an incorrect use of vocabulary may occur. In the area of syntax and morphology, students with autism may struggle with verb tenses and articles and using them appropriately. Failure or delay in the use of syntactic rules. Perseverative use of questions. That might be a result of them being on the receiving end of a lot of questions. So they've learned that this is the way you chat with others. So just a lot of questions might be happening. Pronoun reversal, as I mentioned earlier, can be an issue as well. Echolalia, this is a big one that we see a lot. And again, we talked about the three main kinds: immediate, delayed, mitigated, which is when it changes it a little bit, and then non-communicative echolalia. Prosody, where we might see wooden speech or flat effect, that robotic kind of tone. Monotonal speech. High pitch, they may use a weird baby voice all the time. Or hoarseness, harshness, hypernasality, things that many of us would find aversive in someone speaking. There may be some issue with volume control, or they might use a sing-song speech pattern, which we would obviously be like, what's going on there, right? The area of nonverbal communication, they may fail to use nonverbal communication to enhance their communicative intent. intent. A lot of issues we may see are no eye contact, or not really having the right type of body orientation that we would read as being part of this communication. They might be grimacing or making a face. Pragmatic problems include limited language uses, a lack of spontaneity, failure to reciprocate and take turns in conversation, which is tough, right? It's hard to talk to somebody if they don't come back at you. They may respond with an inappropriate amount of communication, so they may start talking too much. Failure to maintain a conversation, failure to recognize the speaker's intent or to match the speech content to the meaning. Or there might be some rigid and contextually inappropriate speech. In the area of form problems, you might have idiosyncratic communication forms. Often they might use aggressive behavior or self-injurious behavior to communicate. Failure to use appropriate nonverbal forms of communication. Their speech may often not be used to communicate. So they might just be saying the words to say the words. They may use crying, tantrums, echolalia, physical manipulation, or gestures to communicate as well. So a lot of this, because it's coming in a different way that we're maybe not expecting or used to, we really have to be paying attention and noting patterns so we can figure out what they're trying to communicate, so we can help kind of shape that behavior in a way that's more socially understood. Related communication problems, there might be that the individual also has an intellectual disability. There may be no awareness of cause and effect, a failure to understand symbolic representation, a lack of toy and imitative or imaginative play, non-functional use of objects, a failure to attend to environmental stimuli, or a failure to take turns or understand another's perspective. Those can be very challenging. Egocentric thinking, right? They're in their own space, not really that. It's that whole failure to understand someone else's perspective. Little interest in exploring the environment, little interest in people, little response to communicative models, an over selection of stimuli, a failure to transfer or adapt learned skills. So these are challenges that you might see with your students, any one or several of those. But the nice part of this breakdown is it may help you kind of hone in on what you want to practice or work on with your student. Now let's look at assessing language and communication. So the learning objective here is to describe the components and importance of a comprehensive assessment of language and communication. When we look at language and communication for our students, it's usually a big part of what we work on with individuals with autism. So extensive assessment may be necessary. It's often necessary because of the difficulties our students experience across all the different areas of language and communication. So it should occur within these 4 domains. You're looking at social, communicative, linguistic, and cognitive. So we're assessing in all those 4 areas. So we get a really broad grasp of our students' strengths and challenges. The text talks specifically about some assessments that are geared for children with autism and or language delays, as opposed to using language assessments that are for everybody, because the ones they outline here really do a better job of getting you to understand what target skill is actually missing in order for you to hone in and create appropriate goals and objectives. Whereas when you're using some of the other types of language assessments, they may not actually lead you toward the right kind of goal or objective to get at what the child really needs to work on. So the recommendation from this text includes the Verbal Behavior Milestones Assessment and Placement Program, or the Assessment of Basic Language and Learning Skills Revised, the ABLES-R, or Peak Relational Training System. So I do want you all to take a look at your case study student and their last full evaluation. the last thing a speech and language pathologist did or your school psych did having to do with language? Did they use any of these? I see the ABLES a lot. The VB map I've seen used a lot as well. So I encourage you to kind of take a look and see if those were the ones that were used for your student. What you will do, and those types of assessments are typically done by someone specifically trained, particularly in ABA, in order to deliver the standardized components or follow the procedural fidelity of those assessments appropriately. What you as teachers will typically do is more of an informal language assessment. And this includes an ecological assessment like you did the other day, with a focus on specifically on communication itself within different settings and situations. This also includes direct observations. So it's paying attention to what's going on and taking notes so you figure out where the patterns are. Also, that involves interviews with people who know this child really well, like parents and family, maybe your paraprofessional. And table 6.4 has a lot of great just questions to ask folks under the different areas too, to guide that. So I highly encourage you, especially as part of this case study, to do that. Talk to the family, go through some of these questions and make notes. It may help you figure out some things about your student. But in general, informal language must have two primary components. You need to look at a range of communicative functions and forms that are exhibited by the student. And you want to look at the different conditions and contexts under which each type of communication occurs. That's why you're doing an ecological assessment. That's why you're just watching the student in action. And then it's also why you're interviewing folks, because what you may see in one setting may be completely different at home, or parents may have some insight as to why a student is reacting some way. They may have already picked up on certain communications from the student and can help you interpret that. There's a great Figure 6.1 has a great little communicative forms data collection tool that you could use to collect some data on how your students using different forms and functions of behavior, whether they're using complex speech, whether they're using phrases, single words, signs, echolalia, whether they use just like a nodding of yes or no, or if we see some of the more challenging behaviors based on certain activities. So again, I encourage you I'll provide the form that you'd be able to download and use in your classroom to provide some informal assessment in that area as well. And then this next section, we're going to look at language and communication training. So once you've done all that assessment and you sort of targeted those areas of need, and you prioritize them, right? Then you need to figure out how to teach to those, right? So that's what this next section is really going to talk about, and that we'll go through here in just a moment. Our objective for this section is to identify specific approaches to teaching language and communication skills, and then compare and contrast components of each. So you want to undertake comprehensive language and communication assessments so that you can develop the right kind of curriculum for your student, and really hone in on what your student needs to learn, because you may have to be very targeted, and honestly, being able to be very targeted will certainly make your instruction more efficient and effective, and really can help figure out how a student learns best. So before you begin the curriculum part, you would want to establish the goals and objectives for your student, because then you know what you're aiming toward and what maybe is the best way to teach it, because there are different methods that might be more effective based on what you're trying to teach. It should be also related based on the interrelationship of communicative, social, cognitive, and linguistic abilities of your student. So you really need to know their strengths in all those areas in order to target your instruction appropriately. And then ultimately, you want to keep in mind your whole purpose in all of this is to foster independence and competence. So the text goes into kind of three categories of instruction and deciding what to teach in language or communication. So there's the structural goals and curriculum, which highlights really the linguistic and cognitive domains. And then you work on that expressive vocabulary development, correct grammar and articulation. It's commonly used when teaching augmentative alternative forms of communication, especially. So it's a very, obviously, just based on the name of it, right? It's very structured. A lot of discrete trial training would be involved in this form. Functional goals and curriculum, that's when you're really looking at teaching functional communication skills, so that appropriate topography. So instead of having a tantrum about something, you're teaching them the appropriate way to communicate or mand that item that they wanted, or the thing that they wanted to avoid. So the table 6.5 talks about, table, and in the text there's a lot of great tables that really highlight, going back to that structural goals and curriculum part. It breaks it up into the receptive language, articulation, expressive language, and syntax, and it kind of bullet points things that you would focus on in those areas. And the same thing with the functional communication. Table 6.6 really goes over that, and shows you kind of the flow, right? You're going to move from elicited responses, so you're trying to create, you make a request of the student and have them respond to you, and to eventually hopefully encourage them to spontaneously make a request, and that's kind of the transition, right, that we're ultimately going for. So it breaks it down into semantics, the pragmatics, and then functional communication itself. So it really helps, I think, just sort of give you some concrete examples of the things you're trying to work on. As far as cognitive goals and curriculum, you're looking at imitation, attending to things in the environment, that joint attention, helping to guide others' behaviors, using being able to use simple gestures. You're looking for these pieces before you sort of go to that next step with your students' skill development. Table 6.7 talks about the pre-linguistic curricular sequence. So you want to work on attending first, and then the imitation. Once you get their attention, teach them to imitate. And then you want to go through encouraging play, and then trying to build on communication goals through that play. So the best practices for teaching language and communication are debated by research, because it's based by different researchers, because the way you approach it depends on how you believe language develops. And there are different philosophies behind that, theories behind that. This text focuses on a kind of a combination of a behavioral model, Skinner's behavioral model, and a social interactive model that Bruner developed. So the text really talks about how combining the two, especially based on kind of where the student is currently in their skill level, can really be an effective method. So we have that behavioral model, that ABA, where we're using that discrete trial training. It's very systematic. And you're shaping the communication and language behavior. And then you also look at the interactive or naturalistic model, which is that milieu teaching we read about in the last chapter, or might have been chapter 4 actually, and looking at more that social space and really observing students' interactions with others and trying to take advantage of those teachable moments when they're happening. There's additional language strategies which include observational learning and expansion. Your text gives a lot of great breakdowns on how to follow milieu teaching procedures. Like, how do you do a model presentation? How do you mand model? How do you use time delay? So please, please, please read through those. I think you'll find them really, really helpful when you're trying to develop your plans for your students. And many of you work with students who need augmentative and alternative communication systems, because there's generally, for a variety of reasons, speech for them is very difficult to shape or prompt. And so they need to be taught alternative ways to communicate. A lot of folks, they don't want to go that route because they think that somehow that will delay speech, but the research does not support that at all. Because ultimately, if the speech is easier, then that's what the student's going to eventually use. But in the meantime, it may help a lot with challenging behaviors by teaching them an alternative form of communication. And you, those of you who are part of the adapted program will take an entire course, or you may have already taken it, on AAC systems. Different examples of that include sign language, a visual communication system that uses objects, pictures, or words. And then we have kind of our higher tech end, the speech generating voice output devices that can produce some type of computerized speech with a button, a switch, or a picture use. And ultimately, you'd want to, eventually you kind of start out with the sign language and the visual communication, and you lead up to that speech generating device, because then the student actually has a voice, which is really nice. All right, let's do a quick summary of the chapter. Oh. There's a lot in this text about ways to teach. I'm not going to go through all this in this presentation, so please go through those carefully and let this help guide you in your plans for your instruction. Let's summarize quickly the chapter. Most important thing to teach may be language and communication skills for your students, because that is a huge barrier to all aspects of their life. So that might be a primary target for you. Students need these skills to affect their environment, to be more independent. Without them, they may rely on that challenging behavior you see sometimes. Functional communication ability directly impacts students' prognosis and immediate well-being. Language and communication are challenging to teach because language is complex, and especially in that social and cognitive development point. The training here may involve skills across several domains. The teacher needs to read and learn as much about relevant training as possible. So this chapter is not enough for you to be a skilled teacher of communication and language. So keep in mind, this is an area that you want to keep working on and reading about and learning about. You must consider those long-term goals. If you know what the end goal is, the student wants to be or do or whatever, then that's really what you want to keep in mind as you develop those intermediate and short-term goals for your students. Remember that independence across settings is really our ultimate target. We're trying to get to that point where that student can be as independent as humanly possible. So you always have to be thinking about how you're going to fade prompts, how you're going to focus on teaching generalization when the student's ready, and getting them so that they don't rely on that paraprofessional for every interaction in every class, right? You want to start teaching everyone how to fade those procedures, and so that our students can lead the most independent and fabulous life that they can. Thanks, you all.